Aloha, good afternoon, everybody. My name is Keoki Kerr. I'm the Communications Director for the Hawaii State Teachers Association. Welcome to this virtual news conference announcing legal action by the HSTA against the state of Hawaii and the Hawaii State Department of Education about flawed school reopening plans that compromise the health and safety of our schools and greater communities. Today we have three folks here to address you. They're each going to give some opening statements, and then we'll be taking some questions live from reporters. Corey Rosenlee, our HSTA president. He's also a high school social studies teacher at Campbell High School. Then we're going to hear from Dr. Scott Miscovich from Premier Medical Group. He's been very involved in fighting COVID and handling lots of testing all across the state during this crisis. And then from Eric Seitz, who's an attorney for special education students. Many of you reporters and folks in the public will remember he's also the legal mind behind the Felix consent case, a landmark case that brought about some major changes for special education students here in Hawaii some years back. So without further ado, we'll turn things over first to Corey Rosenlee.
Aloha, I'm Corey Rosenlee, President of the Hawaii State Teachers Association. Right now, Hawaii has the fastest growing COVID-19 infection rate in the country. And just a couple of hours ago, it was announced that we've set a new one-day record with 355 new cases. How can we even think about bringing students on campus on Monday? We need to take immediate action to keep all students safe and stop them from returning to school buildings. 100% distance learning should be used until the end of the first quarter or until public schools are safe for students, teachers, and staff to be together on campuses. After HSTA's call last week for starting the year with distance learning, the Department of Education made adjustments to school reopening, including having students start the first 4 weeks of the school year with what they claim to be is distance learning. First of all, next week, tens of thousands of students and teachers are still physically returning to campuses. The DOE says the intent is for parents and students to pick up distance learning packets and materials. HSTA believes this can be done by setting up a grab and go system or a drive-through process that some schools have wisely already decided to use next week. I want to applaud all the principals across the state that have chosen this model. At other schools, unfortunately, they will be bringing hundreds of students into classrooms for many hours, increasing close contact and transmission of the disease. Let's be clear. It is deceptive to say students will be 100% distance learning for 4 weeks, because next week, students will be on campus, will be in classrooms with face-to-face learning. To have teachers be required to meet with students face-to-face in the middle of a raging pandemic is reckless and will risk the lives of everyone. Public schools already have positive cases on campuses, and the Department of Education and the Department of Health did not disclose to parents and the public this information until after HSTA forced their hand or after the media inquired about outbreaks. Yesterday, our members reported new cases at Keolu Elementary, Roosevelt High School, and Poakea Elementary. And there may be more, since the DOE and health departments still have no policy of how they're going to share cases with public and parents. Second, the DOE states that vulnerable students are going to be allowed on campus. A child's special needs does not make them or their teachers impervious to this virus. In fact, high medical need children are often less than 6 feet from their teachers, and many are in high-risk categories. Also, because these students may require one-on-one assistance, there will be situations with multiple adults and children in one room, putting everyone at risk. Third, the DOE has announced face-to-face learning may resume on September 14th. The DOE has claimed it will work with the health department to assess whether students can safely return to in-person blended learning models or if distant learning needs to continue for the remainder of the first quarter. That announcement will be made on September 8th. The health department still has not provided written guidance or metrics on what COVID case spread levels should be reached before the state can deem that our schools are safe for the return of students. Also, the DOE announced that Lahaina Luna and Lanai complexes will be using distance learning for the entire first quarter. This should be the policy for the entire state. Fourth, the DOE is not following the section of the HSTA's contract that states, and I quote, "When students are sent home from school or are not required to attend due to emergencies which endanger health or safety, teachers will not be required to remain at nor report to said schools." It is very evident that students are being sent home for health risks, but the DOE will not admit this and maintains that our schools are safe for students to return. This is disingenuous and is failing to protect the health and safety of teachers. The DOE is being reckless and putting our students, our teachers, and our community at risk. So the HSTA will take 2 legal actions against the state by filing a prohibited practice complaint with the Hawaii Labor Relations Board and a class grievance against the state of Hawaii and the Department of Education. First, HSTA will file a prohibited practice complaint with the Hawaii Labor Relations Board against the state of Hawaii. HSTA requested impact bargaining with the Hawaii Department of Education over the changing community conditions with COVID-19 spreading and the newly modified instructional plans. The state has refused HSTA's demand to bargain over the change in working conditions in light of the exponential growth in the spread of COVID-19 and the infection at a growing number of schools since the beginning of this month. The DOE inappropriately claims that there is no significant change in working conditions. Buildings are open, schools are safe, and students can return, and teachers will need to report to their work sites next week. HSTA is also requesting that the Hawaii Labor Relations Board issue a declaratory ruling that the state's planned action violates the relevant state workforce safety rules by forcing teachers into a hazardous workplace, and an injunction to prevent the state from violating these rules. Second, HSTA will file a class grievance on behalf of Bargaining Unit 5 employees because of violations to the HSTA contract and memorandum of understanding reached with the state of Hawaii in June. Unfortunately, a class grievance and a prohibited practice complaint take time. Therefore, our union sent an email to all of its HSTA members reminding teachers of their individual rights and the actions they may take. First, teachers may utilize their personal leave or their sick leave. HSTA has been warning the DOE that we are concerned that teachers will be taking sick leave next week to avoid jeopardizing their own health and safety and the health and safety of their families. Because the DOE is choosing to do face-to-face learning over distance learning. As a result of this, the DOE released a memo on August 10th expanding the use of high school graduates as substitutes. In the drive to have face-to-face learning, the DOE would rather have high school grads without college degrees teaching our students rather than experienced qualified teachers using distance learning. 2, if an individual teacher believes their personal safety is jeopardized or endangered, they should notify their principal, who has to take appropriate action to resolve the issue. 3, parents, teachers, and community members should also reach out to their principals and complex area superintendents who have been given wide latitude to deal with health and safety on their campuses, including utilizing grab-and-go systems for distance learning materials. 4, on Monday, August 17th, we are asking every teacher to wear black. Black is the color many people wear to funerals, and that is exactly what will happen if students and teachers meet in person on campuses Monday and beyond. HSTA will also ask the Board of Education to take action at its August 20th meeting to ensure 100% distance learning for all students on all islands until at least the end of the first quarter. and ensure that teachers have the option of teleworking. And finally, the teachers of Hawaii are asking Governor Ige to take emergency action before Monday to protect Hawaii's keiki by stopping any in-person instruction of meetings in schools. Governor Ige, you hold the safety of our children and educators in your hands, and you have the power to stop these dangerous plans before we have to bury a teacher or a student. Governor Ige, please take action. Thank you.
Thank you, Corey. Next, we're going to hear from Dr. Scott Miscovich from the Premier Medical Group. Doctor?
Thank you, Keoki and Corey. That was very well put. So congratulations for standing up for the people that need you, for standing up for the people of Hawaii. And that's who I want to speak to. I want to speak to everyone. I do want to highlight, as I told everyone prior to setting up, I am the son of a 38-year teacher who taught 6th to 8th grade science. So this is kind of personal for me in honor of my late mother. And today, the die is cast. People of Hawaii, the legislators and the governor, 355 new cases. Do we have to say anything more? Does anybody need to actually even contemplate, is it time to be sending children and sending people and sending teachers, sending special education students and teachers' aides and people working in whether it's the cafeterias or even the custodian staff, to send them into this environment when we have a perfectly adequate option to help these students continue to learn. We are now in the state of Hawaii at a critical phase. We have passed the phase of watching. We are now at a phase where at the highest level of our government with 355 positives, we need to be prepared to have alternative hospitals, alternative emergency rooms, alternative services. And if we keep going down this path, we're going to have alternative mortuaries. That's not what we need as this state. This is not about, one side saying they need something versus the other or alleges. This is the life, the safety of everyone in the state of Hawaii. I want to clear up some myths. There have been myths about, children, well, they don't get that sick, so it's okay if they go back. Well, it's one of the highest growing demographics of COVID spread in the state of Hawaii and in the United States of America. There are children who have died, fortunately not as many as other age groups. The other myth we need to put to rest right now is that children do not pose a risk to other people in their family that they're not shedding because they get mild symptoms. False. Children pose the same risk of shedding this virus, and sometimes even they're shedding it 2 days prior to other carriers, and their symptoms are often mild and very, very mildly detectable. What does that mean? It's a risk to everyone at home. Look at our multi-generational families. How many times are we going to have children going to school that are going to then bring this disease home to a multi-generational family member, or God forbid, someone that's a kapuna that's over 75, where we're going to start seeing that, which we are seeing. Look at our mortality. Look at the deaths. They're all people over the age of 60, 65, or 70. So we're saying this type of action is acceptable to know that not 1%, 2%, it's 100% that if we let this happen, we would be able to track back disease that would lead to the deaths of citizens in the state of Hawaii. That's not acceptable. It's not acceptable for anything, let alone in the most virulent pandemic that the world has seen in modern history. And this disease is spread through respiratory transmission and respiratory droplets. We have clearly identified that the risk of spread is within enclosed environments where you have groups of people together. What is a classroom? A classroom is a perfect place for this disease to spread and the disease is so contagious now, you don't need 15 minutes face-to-face before you hit a serious contact. Most of our data shows that if you're within 15 seconds of someone unexposed with a mask and you're breathing, then you can get this virus. Second, another myth now, yes, I am a 100% believer in masks, but the Duke study from 10 days ago shows all masks are not created equal. And we would have to eventually go to a position where all teachers and all students, if we ever get to the point where we can have face-to-face learning again, we have to be serious about teaching what is safe and what is not safe. Finally, listen to what we're talking about now, what Corey said so well. We don't have contact tracing. We clearly all have been lied to by our Department of Health. We do not have anything to notify anyone that they have been exposed. And to think that just because someone says something that we're supposed to believe now that there will be more, it will take months for them to get something effectively in place to start being able to tell the students, to tell the families, to tell the teachers, to tell the custodians that they have been exposed. By the time they're notified, it will be too late. That disease will have spread again. And as Corey said, we have the highest transmission rate spread, the RT, which is the spread of this disease, the highest on Oahu in the United States of America. That means we have the most rapid contagious spread of this disease, and our numbers clearly demonstrate that. So people of Hawaii, the teachers, the students, the families, if I have a student that's supposed to go to school, I'm getting this call. I would never send a student to school. It would be reckless and would be putting your student in danger. Second, as I said, as a son of a teacher, I feel for a lot of our teachers. Let's face it, our teachers are human. They can have diabetes, they can have blood pressure, they can have heart disease. To be putting them at risk for their health for something that is so unnecessary, unacceptable. So from my perspective at this stage, there should be no question whatsoever that there is no way for the safety of our population that we should be proceeding with anything but grab and go, distance learning, keep our keiki at home safe, and actually we should be shutting our state down, as I've said numerous times. Stay at home, work at home, 1 month, no questions asked. Thank you.
Thank you very much, Dr. Miscovich. And now Eric Seitz, who's been an attorney for special education students for many years in this state. Want to unmute yourself there, Mr. Seitz, and then there you go, perfect. Go ahead.
Okay, thank you. I have notified the Attorney General's office that I intend to file a lawsuit against the state of Hawaii to stop students from going to school on Monday. I do that sadly because I've been receiving calls and communications from parents of special education students in particular about how desperate they are to have their kids at home and have to meet the needs of their students without any help from school officials, despite federal laws that require assistance to be given to children with disabilities. Those parents are desperate for help with their children, and their children are not moving forward and are in many cases suffering from the lack of opportunities to go to school to get the kind of help to which they are legally entitled. But sending them to unsafe schools, even for 4 days, classrooms in which we've heard there will be more than 10 people because there may be 7 or 8 students, but those students have aides and assistants that will mean as many as 15 to 18 people in a small confined area. That violates every guideline from every agency, national and state and local, and it puts people as the teachers at risks. I cannot conceive of any circumstance now where any rational policymaker or decision maker would want to put children, teachers, staff members in the schools in an unsafe situation. And it is beyond debate that what's being proposed for next week is unsafe. So we will proceed with a lawsuit if necessary. We understand that legal actions are being taken by the union, but those actions take time. We can approach the court and get an injunction immediately if necessary, and we are preparing to do that. My hope is that some sort of level of sanity will prevail. Dr. Miscovich mentioned that there were 355 cases in Hawaii reported today. It's also been publicized that in Oahu Community Correctional Center, we went from 7 cases yesterday to 70 cases today. And the experts whom I represented in that litigation, when we tried to reduce the population somewhat successfully, would predict that we're now going to have as many as hundreds next week based upon current trends. The news, CNN reports today that already after just a few days of school opening on the mainland, 2,000 children and teachers and staff members are in quarantine. How many more do we have to expose to serious risks before we take the actions which are being asked of the decision makers today? I would hope that I don't have to put that decision in the hands of a judge. I would hope that Governor Ige, the superintendent, and people who claim to care for students and teachers and the citizens of this community would take the proper action. In any event, please, if you have an opportunity, send emails, contact people, urge them to do the right things, because all of us will be put in increased danger if tens of thousands of students show up for even just 4 days before distance learning begins. We need to take more creative and more flexible approaches to avoid exposing people to those kinds of risks. Students are entitled, teachers are entitled to a safe and secure environment. And we certainly hope that that can be created and that that will be the primary operational goal before we return to any mass forms of education.
Thanks so much, Mr. Seitz. I know you have to go because you have a legal case. So we're gonna, does any reporter have a question for Mr. Seitz before he has to take off? Would that be, I see Mahea from HNN in there. Do you have a question for Eric Seitz because he's gonna leave shortly? Or
Yes.
Yes, go ahead, Mahea, hi.
We don't know publicly what the governor is going to say at 2:30 this afternoon, but obviously there's speculation that there could be a month-long shutdown. So does this make the potential legal actions and the legal actions by HSTA today moot, or what could happen after the announcement?
Well, from my standpoint, it certainly would moot any action that I would take because it would be unnecessary. And I certainly don't want to drag anybody to court unnecessarily if we can achieve the result of avoiding the kind of exposure which school openings, even for 4 days, will bring about. So yes, and we're not in any position to file anything before 2:30, but if we are going to have to file something, it'll likely be filed tomorrow. But see, we certainly will postpone any legal actions if we can achieve and accomplish the results we're seeking otherwise.
And if I can respond too, there's been no indication that this would happen for our schools. And our teachers have seen time and time again that somehow there are always exceptions for our schools, and that the rules that decision makers are making exempt schools. And somehow they believe that the virus does not impact them. And as Dr. Miscovich would say, that's not the case. So we have got no indication that's going to happen yet.
And so, Corey, would you clarify, would the legal actions planned by HSTA still stand even if they said no school on Monday?
Yes, they would.
Thank you. And Jennifer Keller has a question for Eric before he has to take off to court.
Eric,
Jennifer?
can you please describe what kind of court action you are looking at? Would this be federal court, state court? Who would the plaintiffs be? Would it just be the students at schools that will be meeting for in-person instruction next week, or a more broader group of plaintiffs?
Well, as I did when some years ago, when we ran out of money, I'm looking at broad classes of action that can be taken in behalf of parents, in behalf of teachers, and in behalf of kids themselves, because all of them are affected by this. I would say as well, so too are principals and people represented by the other unions who represent the custodial staff and the administration on the school campuses. Everybody is at risk. So we will frame a lawsuit as broadly as we can, and we will seek injunctive relief, a temporary restraining order, if it becomes necessary to do that. Whether we'll file it in state court or federal court, I have not yet determined. We're having to do some research to figure that out. But either way, the request will be for immediate injunctive relief. And the only way we can really accomplish that would be to file something and ask a court to intervene right away.
Okay, thank you. And I think we have one more for Eric before he's got to go. Tiffany DeMasters. Hi, Tiffany from Big Island Now. Tiffany, can you unmute yourself? And there you
Hi,
go.
can you hear me?
Yes, we can hear you. Go ahead.
Great, thanks. So my question, Eric, is what sort of options are there for these parents who have special education students? You know, if, you know, we move forward with no classes, what help is there for them?
Well, that's the next step. And we've been contemplating that over the past weeks. I've been getting desperate calls from parents. I've been attending Zoom IEP meetings all over the state where we've been trying to address how we can get services to kids in this period of time. There have been successful efforts to do that elsewhere on the mainland, and we can learn from that. But unfortunately, we face here a bureaucracy in the Department of Education that basically says we do it one way and our way, and we don't want to even hear from people elsewhere as to how we might be able to meet the needs of these kids. The parents are climbing the wall. The kids are certainly not gaining any benefits from this, and in many cases are suffering severe harm. So we do need a major effort to sit down and figure out, in light of whatever the schools are going to do over the next period of time, how we can provide sufficient and additional resources to these families and to these kids. But unfortunately, we haven't done that. We haven't done it over the past 5 or 6 months. They basically have provided minimal services, and I think it's horrendous. And at some point, there's going to have to be an accounting for all that. But right now, we're concerned prospectively how we take care of these children and meet their needs. And the DOE, in my estimation, has done an atrocious job of that. And now what they want to do is send them back to school and put them at great risk.
Thank you.
Thanks so much, Mr. Seitz. And we know you have to take off, so we're going to let you go off to your other case now. Thank you, Eric Seitz. We're going to continue things along here. Thank you for
Eric.
time out of your day.
Thank you.
Reporters, if you have other questions, please put your name in the chat. I saw that Jennifer Kelleher from AP has a question for Corey. Jennifer, go ahead. And anybody else, just put your name over there in the chat. I'll call on you. Thank you so much.
Thank you. Hi, Corey. And just help me understand or clarify what the in-person instruction is that will be happening next week. Is this more than picking up materials? Is it how they'll be picking up materials? Are there some schools planning to meet for in-person instruction beyond the Hana and Molokai schools in the DOE's previous announcement?
Yes. So what we've heard from is that schools will be bringing on students to campus. They will be having face-to-face learning. There are campuses that are going to have hundreds of students on campus at a given time. Some schools will be doing the pickup of materials, but that is not happening statewide. And so our deep concern is for those schools that are planning on having students and teachers face-to-face learning starting on Monday.
And this is sort of in defiance of what's been announced or what's been mandated?
No, and that's the concern, is that the Department of Education has said that we have distance learning for the next 4 weeks. That is not correct. We have distance learning starting for 3 weeks only. The next week, the policy would have been that schools could decide how they wanted to do this. And some principals have chosen the grab and go method, and others are having kids on campus with teachers for an hour. That's what the policy was from the DOE. That's what we think is putting everyone at jeopardy.
Thanks so
Okay,
much.
sorry, just to be
ahead,
clear
Dr.
then, and this would be in-person instruction at schools beyond Hana and Molokai?
That is correct. Beyond just Hana and Molokai, schools across the entire state, okay, schools across the entire state, there will be face-to-face learning that will be going on with kids in the classroom with their teachers. And in some schools, it will be hundreds of students.
Okay, thanks.
Thank you. Next, Ashley Mizuo from Hawaii Public Radio. Hi, Ashley.
Hi, thanks. Also on that note, how was that decided? Was it just is it school by school decisions by their principals on whether they would be coming in? And then also, how will it work, I guess, how is it determined on which schools would be doing face-to-face learning in the beginning? And is there like any list or something that we can look at that would tell us?
No, so we've been trying to get the data school by school. It was decided by the principal, and that's why we're asking principals that are planning to do this to change that. We do not believe it is safe for students to be on campus, and that is our biggest fear. The second one is, even after next week, there is still going to be other students on campus. And it has not been clearly decided what students will be on campus or not, and that is a deep concern as well. To what Dr. Miscovich said, and this is what HSTA's position is no students should be on campus. No one is impervious to this virus, and it's only putting teachers and students at risk to do that.
Thanks, Ashley. Any other reporters have any more questions? I see, hi, Suvan Lee.
Hi,
from
okay. Can you hear me?
Yeah, we can hear you fine. Go ahead.
Dr. Miscovich, you said earlier in your remarks that Hawaii is showing a rising number of youth cases of COVID-19. The last I saw that specified such a breakdown was from July 31st. Do you have any other data that indicates there's a rising number of minor COVID cases?
A lot of my data comes across from actually leading, a large portion of the testing throughout the state. I'm also in coordination with a lot of the other organizations that are doing testing, because I think we're all frustrated with the lack of information that's coming out from the DOH. So we share our data. And again, if you look at the data I have, we just, in the last couple of weeks, we've identified hundreds of the positives. And children are becoming very, very much part of it. What's happening now is this disease is so widespread that it's getting into families, and it's spreading through the families. And that goes along with the fact that we're not actually doing contact tracing to show that the disease has spread into a family to try to get these people to be isolated. It also goes along with the fact that we're not effectively managing this like other countries or states that have been effective, where you set up quarantine hotels. You should have an individual, if they're in a big extended family, to be pulled out of a 10 or 12 or 14 people living in a 2 or 3 bedroom, and they should be put somewhere. But we haven't done that as a state, so therefore it spreads through the family. We all know, and the data is very clear, what the skewed spread through our unfortunate demographics of both our Marshallese population, our Pacific Island population. We know that that population has larger cultural homes where they live together in more broad spread homes. So those are the factors that are leading to this. And so, the data is going to be very clear that this is more in the pediatric population. It's going to continue more to show it in the pediatric population. Can I give you the specific data of the specific numbers? No, but it will be present that this is very much in our pediatric age population.
And I just want to add to that the information before too. what we've been hearing from schools is that they will be doing standardized testing, that parents are coming on campus. And I can probably look at you, Dr. Miscovich, but putting people in a confined room for hours and bringing additional parents on campus is not something that I expect you would advise.
Never, never. I mean, putting anyone in a confined room right now with COVID, whether it's school, whether it's strangers, whether it's your family, at risk. And we all know the status of our schools. Most of them are not all that modern. And, you know, I have been consulting with schools across the state on the private standpoint, and you have to go individual, classroom by classroom, and look at the ventilation, look where the seats are. And have we really done that? Has anybody with expertise gone class by class, school by school, and given them an overview of what should be done? I really don't think so I'm even talking about looking into the future. We will, as a state, eventually have our kids back to school. It's going to happen. It's going to happen when it's safe. But we should also be taking this time to be thoroughly evaluating how we can safely do it. And it's not just a general one-off. It's a very complex issue that looks at facility by facility, looks room by room. That's the only way we can eventually do this. And from what I've read and what's been presented, that has not happened.
Okay, and next from Susan Asoyan at the Honolulu Star Advertiser. She's having audio problems, so she just asked me to ask Corey this question. Corey, could you be more specific about what you're calling face-to-face instruction? Is this with the vulnerable and special education students? Are you also referring to other kids coming in to pick up materials and meet teachers? What are you referring to there, please?
So starting on next week, Monday, it is for all students across the state. There will be face-to-face learning going on. Okay, I know this is getting confusion. Some schools have decided to do pickups by parents, but this is not happening at many schools. So I want to be very clear about that. The following week, it is vulnerable students. Now, how that's being interpreted is also sometimes happening school by school. And that also deeply concerns us. You know, we've heard it can be even more than special education students. And so, you know, I am deeply afraid that we are bringing teachers and students on campus, not just starting on Monday, but after that. HSTA has also requested that teachers have the right to telework so that you don't have hundreds of staff on campus as well. What we've seen just over this past week is students haven't even shown up and we're having outbreaks on campuses. So, you know, we're asking if people can telework, that they should be able to telework, and that all students across the entire state should also be using distance learning.
Thank you, Corey. I have a follow-up question from Jennifer Kelleher at the AP. She has a question for Dr. Miscovich, followed by a follow-up for Corey.
Thanks. Yeah, for Dr. Miscovich, some private schools have already started in-person instruction. Do you think private schools should also not be open right now? And what about preschools and daycares that have been open?
Okay. I specifically have worked closely with Lizardman Academy and Hawaii Prep, and they have taken, at least we've been working on it 2.5 months to prepare their plan. They have gone meticulously room by room, and we still, because even with how meticulous they have been, and they fortunately have, you know, fairly good facilities, they're still going to home-based learning. They're not going to be, you know, staying up at Lizardman, I know. And then Hawaii Prep has the luxury of having tremendous amounts of space, and they've really set up numerous outdoor teaching areas. They have quarantine facilities. They have really taken all the steps. So from that perspective, if we go to a state lockdown, sure, they have to stop. Have they taken the steps where, you know, I was able to watch firsthand what they're doing? I mean, they've done a really good job. At this stage, do I believe that every school should be open if they even go through that steps? No. When 355 hits, everybody should be closed. It should be shut down. There should be no questions that there should be no in-person learning, no students going into a group classroom. A grab and go is the best we can ask for. Teachers, shouldn't be in any kind of environment. They should be able to be at home.
Thank you. And Corey, I just wanted to follow up. Are you getting information about students on campus from teachers, from principals? Is the DOE communicating their plans with you guys?
So these are the school plans. This was always in a place in the DOE's plan. If you look at the plan, it says that students will be on campus. Only some campuses are they choosing to do this grab and go. So we have surveyed some schools. I've heard from across the state. And the baseline is the DOE's plan.
Sorry, and you mean their plan regarding picking up instructional materials?
No, the plan is that students would be on campuses, that schools could choose the grab and go, but schools would have kids on campus. So like I said, some will be testing, some are having the parents come on campuses to learn how to use devices. Some are having them go to every single class and switch classes and meet their teachers and doing it that way. The plans are school by school, but this is not an isolated thing. This is many schools across the state will be having students on campus. And that is what HSTA is opposing. And it's all students, not just FSC.
And
self-contained students.
FSC is what you're referring to, special education students there, right?
Yeah, so that's fully self-contained. It is not just FSC. Next week is all students.
Thank you. Okay, next, Ashley Mizuo with a follow-up for Corey.
Thanks. Is there going to be a point where HSTA would consider striking or just telling teachers to stay at home regardless of what their principals are telling them to come back?
So to the first one, we are doing what's allowed under our contract. This is why we are filing the HLRB complaint and doing the class action grievance. That's what's under allowed. So the contract does not allow us to strike. We have to file these legal practices in these cases. To the second question, a lot of our teachers are already deciding it's unhealthy and they are taking leave. And that is why, it's going to be interesting on the school campuses where the principals are doing the grab and go compared to the schools that are requiring face-to-face. I know of teachers already, I've heard them across the state. They are retiring, they are taking leave, they are not going to show up on Monday and put their families and their lives at risk. I am concerned about those teachers that don't have that choice. They're concerned about their livelihoods and putting themselves and their families at risk. That's the big concern.
Corey, can I follow that up? I'd like to add something that I think I can feel free to add. I likely in our practice have at least 250 or 300 teachers that are our regular patients. And I know for a fact that we already are dealing with another aspect that we're not talking about with the teachers is the psychological stress. Coronavirus and COVID in the world has another under discussed problem, and that is how it affects people psychologically. And we have people that we will be putting off of work under doctor's orders. That would be, in my mind, since I've also been the president of the work comp docs, stress associated with their work environment. And that is another angle, because there is a lot of psychological stress to put someone who feels and knows the reality of being in a workplace is putting their lives at risk or putting their family at risk is a very stress producing environment. It's no different. What if a teacher has a bunch of students that are bullies or threatening them, and they go to school and they're not getting the support and they feel that they're at risk? Well, we pull them out. It's a risk. It's a work environment. Our state guarantees that individuals will be provided a safe working environment. And anybody would look at this is not a safe working environment for anyone.
Thanks, Dr. Miscovich. A couple more follow-ups now from Mahia Lani Richardson at Hawaii News Now. Hi, Mahia.
Yeah. Hi, just a clarification, regardless of what happen or could happen later today. The class action grievance, what body does that get filed to?
That get filed to the DOE and possibly the state.
Oh, okay. And that class action, that could be with the Attorney General's office.
To be clear, why it's the state is that this applies to charter school teachers as well.
Okay. Okay.
Thanks, Mahia. And Suvan from Civil Beat, you have a follow-up.
Yes, hi, Corey. Any indication of numbers or quantify those schools that are bringing students back for face-to-face learning next week? I know you've heard anecdotally that there are schools here and there, but do we have like a ballpark number or percentage of those schools? And on that note, what about teachers who use for face-to-face at those schools that are designating that option? Do we have any idea of the universe of numbers or percentage of teachers, full-time teachers that is, who might not be showing up on Monday?
No, we do not have quantified numbers of those. I'm assuming there are quite a few teachers potentially on their breaks right now watching this, and I can assume they're already putting into the chat box whether their schools are going to be going face-to-face or doing a pickup. So I think if you're looking for examples right now, they're providing plenty. Later on, if you want to, we can also provide you with, we've done surveying of some of our chapters, and we already have some of that data, but we do not have it statewide. To the idea of how many teachers potentially won't show up on Monday, it's going to be difficult because it all depends on what's happening at each school, what the teachers' comfort levels are, and we won't know until that happens. But Hawaii already has a teacher shortage, and we do not want to make it worse. I would hate to lose good teachers because they're concerned. And that also means this. I mean, I said this before, is that if these teachers leave and we cannot find subs, that means we may have just high school graduates who are going to have to do the virtual learning anyway with some of these students, and that's going to make everything worse long term.
Thanks, Yvonne. If we have no further questions from our reporters, I'm going to ask a few questions of Dr. Miscovich because a lot of our teachers had questions for him when we learned an expert on COVID was going to be joining us today. I'd like to thank everybody for joining us. By the way, if somebody joined us late, the entire news conference is going to be archived on both HSTA's Facebook page and on our YouTube channel. And I have one last question here from Susan Asoyan, whose mic isn't working. Corey says everyone should do distance learning, but that doesn't work for some special needs kids. Also, if needy parents aren't shown how to use devices, how can their kids get an equal education? Corey. Okay,
so we are suggesting for those first of all, to make sure that all students can do virtual learning. That's why we're having the grab and go next week. And that's something that HSTA does support. That can be done outside. That can be done with social distancing. You know, it's not the perfect solution, but it's better than nothing. For some of our special needs students, there has been some success of doing distance learning with them. And even if not, the concern is that just because they have special needs, they should not be discriminated against and forced to go on campus when regular education children are not. And, you know, from what we've heard from our special education teachers, that these students are often put in confined areas where they may have one-to-one with a teacher or a part-time teacher, and there may be 19 children and adults in one confined space. And from what we've heard from our special education teachers is that they're deeply concerned about their health. And they do not believe that's a safe environment.
Thanks, Corey, and thanks, Susan. I'm gonna continue things here. Reporters, I know you might have to run. That's fine, or you can stay on and listen. But these are teacher questions that we've received in just the last 12 hours when we knew that Dr. Miscovich was clearing his schedule for us. And so they've asked us so many things. We can't ask all of the questions, but here are a couple. Dr. Miscovich. Actually, what we're talking about that, we were talking about special education students. One special education teacher wrote us and said, I will have 8 students and 7 adults in our classroom next week. I'm very concerned about how to keep our children and staff safe. Doctor, does that sort of situation concern you?
Yes, it does, Kyoki, and it goes back to what I was saying that you're putting 15 people in a room, and with special education students, I'm guessing they're going to be in there for a period of time. It's not just 1 or 2 or 5 minutes. They're going to be in there, and they could be in that room for the entire period of time. That is just at the end of a period of a half a day. Every one of those 15 could be have COVID. That's how serious the transition is in transaction of that close environment. It just can't be, no chance that that should be happening. So.
Okay, thank you, Doctor. Another teacher writes, my school is bringing students on campus next week to spend an hour or 2 taking diagnostic assessment tests because the DOE has not moved back its deadline for doing initial baseline testing this year. Is it safe to allow students, even in small groups, to take lengthy tests in classrooms on Oahu next week from Monday through Thursday?
I'll give them, if they each get their own room and you have one child in a room, sure, I'll be okay with that. But if you go into 2, you're putting one of the 2 at risk. So, if you're talking about cohorting more kids together, no chance. It just goes back to what we've been saying before. So literally, if you could send everybody out under a tree or everybody out where they're just totally separated for a prolonged period of time, or one person in a room at a time, I'd say, sure, that's okay. But other than that, no, it's not safe.
Okay, thank you so much, Doctor. Here's one that's interesting from an elementary teacher. She says, how often should kids be taking mask breaks? Administrators are telling us we can give them 1 5-minute break outside during a 3-hour period. What's the frequency we should be taking breaks from masks, especially for my younger elementary school kids?
It then goes back to what we've been talking about throughout this conference, and that is, what's the environment? So if you send children out and they're, being watched by appropriate proctors where they're separated and spread, and there's very nice trade winds going on, they can take plenty of mask breaks in that type of environment. That's a safe environment for them. If they're taking a mask break inside a classroom, no, that doesn't work. They should not be doing it inside a classroom. If you're going outside and you're unsupervised, taking a quote unquote mask break, and at that age group, it's very natural for the kids to want to be close and next to each other. No, that's not acceptable. So it would have to be with tremendous supervision, and it would be in an outdoor environment, which is more acceptable.
We're also hearing from people, on the neighbor islands, where, as you know, Doctor, you've been involved in testing folks throughout the state at various facilities that have had outbreaks. And the caseload on the neighbor islands is much lower, right? So people are like, well, what's the big deal for, concerns about school on the neighbor islands? Shouldn't, we be planning more face-to-face classes on the neighbor islands because their numbers are so small compared to Oahu?
It's a very reasonable question. It's a very reasonable request. That would be something that I think the local authorities on the neighbor islands could look at, that the teachers union could look at. It would have to go down to the specifics. It has to go down, like I said, school by school. This has to be evaluated in a very specific way. And at this stage, if you do look at the spread of this disease, you look at the numbers, you look at the incidence, you look at the transmission rate, that's a very fair question to say that there may be an easier chance to open up our schools on the neighbor islands more safely. But from what I've been told, we haven't done the things necessary to look at each school as an individual school.
Thank you. A couple of things about various health, mandates and guidelines coming from the state health department, Doctor. State health officials mentioned people are more at risk when in close proximity for 15 minutes or more. Is that a federal Centers for Disease Control standard? Is that the standard, or should it be?
We all just shrug at that. I think, let's go back. Most of us have not been very happy with our CDC. Our CDC has been very much bullied and influenced by the current administration that's in Washington. And literally, we know more than enough from studies that if you are breathing in that 6 feet and it's 15 to 20 seconds, you are able to get COVID. So 15 minutes is an eternity for this disease. It's an absolute eternity. That's like, you want to talk about a guarantee you're going to get the disease? I mean, if you're that close to that someone, 6 feet for 15 minutes, I don't know if you're slow dancing or what you're doing to be that close to somebody, but that's just ridiculous. And to think that you're sitting classroom or across the table, you're going to get the disease. So there's much more to it. And I do want to highlight again to all the people listening and to all the people of the state, we need more direction on the quality of the masks. Masks, yes. Medicine, we all 100% support the masks. But now we finally have a good study coming out of Duke that we need to start getting a little more careful which masks we're using, and especially which mask we're going to send our kids to even a friend's house with, or even in our own home. So there's way more to it. And we haven't even talked about this. And yet we're going to be trying to send our kids back, where there are certain masks that came out of the Duke mask study, which increase the spread of COVID. The respiratory droplets hit the mask, they expand in smaller droplets, becomes more contagious with certain types of, the masks that we're seeing. So where's the education on that? We should be talking about that extensively before we send anybody into any group setting.
A couple more questions and then we'll wrap up, Doctor. And you've been involved in responding to a lot of these outbreaks at nursing homes, private institutions, schools, whatever. Teacher wants to know, what is the best practice when someone is exposed to a positive COVID-19 person? So that person doesn't necessarily have it yet, right? But they've been exposed to someone, their husband has it or whatever. The DOE is telling us that they do not have to serve a 14-day quarantine if they have a negative test. Is that safe?
There's so many bits of misinformation on this that has not been transmitted from our Department of Health. And this is, we get this all the time at all of our drive-throughs. It's that, what is a close contact, right? So if you're in the family and you're living in a home, that's a close contact. I don't care how close you were if you're living in the home. If you drove in a carpool with someone, that's a close contact. If you sat in a 10 by 12 room for a period of time of 15 minutes or more, that's a close contact. Now, especially with like Honolulu Holly, we just did extensive testing down there and other areas. So we have a positive who may be in a group office setting. Everyone in that group office setting, that's even if they're 30, 40 feet away, they should be home as a person of interest that needs to have testing to see that they don't convert into becoming a positive. If you walked into that office, picked up something and walked back out, even though that person was sitting in that desk, you are not someone that needs to go home quarantine. That is a very casual first degree. It is not someone that needs to necessarily stop their lives. Should you be paying attention, watching for symptoms? Can we consider getting testing for that individual? Yes. If you look at the best practices across the United States and across the world, we are starting to test first degree contacts, not only close contacts, but we're getting no leadership or guidance on that. We're also very short of testing material to even be able to do things like that. And then finally, I'm going to couple it with something I don't want to go into because it's another rabbit hole, is the asymptomatic carriers. 40% of everyone is asymptomatic. Second, the common symptom we're seeing now in the field is fatigue, muscle ache, and headache. Headache being one of the number one. Who hasn't had those symptoms? Everybody gets them. And the kids will get those, but they're mild, but they just don't act right. We just don't know who has this disease. I haven't seen any real good definition. I'm getting asked this already by schools that are starting to go in daycares. Well, the child has allergies and they come in with a runny nose. Should I just say, okay, go home and take your allergy medicine? No, they need to be tested. They need to have COVID testing before they return. Do we have any definitions like that to even talk about what's a safe policy? I don't even believe it's even been discussed. So there's so many things that need to be answered with this.
Thanks, Doctor.
Okay, I want to ask one too.
Yeah, go ahead.
But one of the concerns that, I think has been overlooked is how many of our students get to school not using school buses, but the public bus system. If you've ever seen a bus drop off students right before school. So Dr. Miscovich, what's going to happen when we have a packed bus with all these people trying to get to school?
It's going to be, you now have an entire group of individuals exposed in a close contact, and therefore you're going to be taking probably a quarter of that bus that is going to be high risk. And so now that bus goes in and it spreads, and those students go into multiple different classrooms. So now each one of those students has taken that into another classroom and continues. And let's face it, we don't have any contact tracing here that could effectively do that. You would have to then come back and try to contact trace that entire bus. This is the disasters that we're seeing. That's a perfect question. Public transportation is I would not be in public transportation unless it was absolutely necessary. Right now, with the spread we have and the contagious nature, very dangerous. As we're seeing, the bus drivers are getting it, right?
Yes. And speaking of bus drivers, there was a question from another educator who wanted to know, do you feel that the bus drivers, these are school bus drivers, right? Different from city bus and municipal bus drivers, right? Do you feel that school bus drivers can safely supervise students on physically distancing and wearing masks while those drivers are supposed to be driving the bus?
Chance. Let's face it, not a chance. We have enough going on with our traffic. We want them to first safely transport our kids from one point to the next. I can already tell you if we move to a next phase where we start to be able to consider having safety, there's going to have to be monitors on those school buses to make this happen. To put the bus driver in that situation, looking through a mirror, cannot happen. No chance, Kyoki. Can't happen, and it's not something. And then the other thing is, I don't want to go down that path also, but the type of masks that a bus driver, these people who are on the front lines, they should all have N95s. Frontline people should have N95s when they're having that much exposure.
Those are the fancier, more expensive masks, right? That really are a lot safer, right?
The medical grade masks that we're wearing. And, I do get a little tired of hearing, some talking heads that just keep saying, oh, we can't run our PPE shirt, we can't do those. Well, capitalism is alive and well across the world. High quality N95s are now coming in for the sub $3 range, where you can get a good N95. You can wear that if you're not in a big hospital setting. You could wear that 3, 4, 5 days or more. And I don't know, think about a cost of a Starbucks or something, and we're not going to buy a couple N95s. Your staff access to those as a larger scale. Heck, I'll work with Corey to work to get the teachers union access to it, so we can maybe have the teachers union have access to it too. Those are things we have to start thinking. We are in a new world. Don't look back to March. Don't look back to April. We're sitting here and we're in the most aggressive pandemic with the highest spread in the United States. It's time to rethink what we're doing and protect each other, protect our families and the workers, as we're seeing.
Thank you, Doctor. We have so many more. I just want to ask a couple more, if we could indulge your time just for a few more questions. I'm still leaving so many of them out. This reminds me of another question we got from so many of our special education teachers, right, who have to really work close up and one-on-one, right, with a lot of special ed kids. It's, saying 6 feet distance, it's not really going to work for a lot of the younger ones, right, or the people, students with special needs. So here's the question. What are considered best safety practices for preschool and special education teachers when working directly with their students in the classroom? For example, should teachers use face shields, N95 masks, gloves, and gowns? That would probably be safer, but scary for students, this teacher writes. It is nearly impossible to have these students continuously wear masks. Also, these students are often exposing bodily fluids. So what's your advice there? It's a tough call, isn't it?
It's a very tough call, and it goes right back to what I just stated on my last comment. And maybe again, we're all going to have to talk about this for frontline safety. And it's a perfect example. That group needs to have a much more detailed, specialized plan than another type of group of teachers with different students. And so, number one, I would say N95 and mask, yes, because there is uncontrolled body secretions that can occur that are no fault of the student. So at minimum, those people moving forward should have those. Should they have gowns? Not necessarily. They would, if I were them, I would be wearing a set of clothing that they would wear to work. They would then go into a changing area, change out of that, put that in a specialized bag so that they go home and they're not wearing the clothing they had on at work where there could be secretions on them. So that's what I would recommend for those teachers. And then you have to look at the students and the safety of the students. Well, what about another student with secretions coming to the other student? I mean, those students are tremendously at risk because that whole environment has respiratory droplets, breathing, and special needs students are probably not going to be sitting there wearing masks and shields. So it really is a question that I think we're going to have to find a way to effectively keep the teacher safety and the student safety in mind when we start thinking of bringing them back. But we are not prepared to do it right now. Right now, Kyoki, there is no safe way to do this except maybe in a one-on-one situation.
Okay, Doctor, a couple more. There's several mask questions. Is it okay for students to remove their masks when they're sitting 6 feet apart? What if they're facing each other and not facing forward in the same direction?
No and no. It's more like no, no, and no way. The ventilation. So there could be some characteristics, like, for example, when I was doing the consulting for the private schools, so say you have two students and you are face to face, a fan on one side, ventilation coming across, going to an external outdoor environment, much safer, much safer. So there's a specific example of some of the things that I was advising, of how you have to look at each room, and every room's going to be different, and how you look at the ventilation in the way you place the chairs and the way you try to promote a safer environment. But in just the general scenario, in a general classic older Hawaiian classroom with, probably different ventilation, the answer is no to that. That's not safe, and the mask should not come off in that setting.
Teachers are wanting just practical advice because they want to do the right thing for their colleagues and for their kids. Here's one. What should a teacher do if a student sneezes or coughs on someone while not wearing a mask? They have their mask off and they cough on somebody. They sneeze on their neighbor.
Wow. You stumped me, Kyoki, on that one. There would be soap and water, immediately soap and water. That person would be asked to wash their hands and face with soap and water. And, this actually is a really good question. We may get to a point, and I have to say, I haven't had that, but it is something that I could tell you what I would recommend. It would be no different in my mind than in a medical scenario or even a non-medical scenario when you have a needle stick or exposure to blood. And what you do is you don't know if that person's positive, and in hoping to be safe for both parties, you want them both to get tested, and they both would get serial testing so that the person who was sneezed on knows if they were exposed or not. So if I was asked that environment, it would be immediate soap and water, thorough cleaning, but I would ask both parties to consent for ongoing testing. I would say the same thing to Corey with his teachers. If they get sneezed on, coughed on, we should hope that the student can get testing and the teacher can get testing on an ongoing basis to prove that there is no infectivity.
Another teacher, sort of a related question here, because they're on the front lines. They know this stuff better than us who aren't in the classrooms. What if a student is diagnosed with chronic runny nose and sinus issues, making their masks damp and uncomfortable to wear, or the student has allergies and is constantly sneezing? What should that teacher do? What's your advice there?
I don't think that's a teacher question. I think that's a parent question. I think that there has to be a broad policy of every school that talks about what is acceptable for a child to be coming to school. I know most all schools have a screening policy to say, do you have fever? Do you have cough? Are you exposed to positive? Do you have a runny nose? That has to be determined. That probably then is determined back up through the policy that probably then routes through the school nurse and the school policy. So for a teacher to be put in a position to have to make that decision is not fair. It has to be done prior to that, in my mind. And I don't know if that policy is in play, but I think I said it earlier in this interview, if a child comes in, the child has runny nose, and you don't just sit there and write it off as it's an allergy. You need a negative test to determine that.
Couple more practical questions coming in from these teachers. Is it sufficient for teachers to wear face shields only when they're with students, or should they also wear masks?
No, have to have masks also. Face shields are only going to be for the droplets. They're not going to help the small respiratory circulating virus that they're breathing and comes under. So no, that the face shields are mostly just stopping you from getting secretions that are going into your mucous membranes of your eyes primarily, or sticking to some part of your face where, as I'm touching my face, I'm using the example, people touch their face, then touch their mask, then touch their eyes. If you have a face shield on, you're not then touching your face to spread it to other mucous membranes. That's what that's stopping.
Got it. Two more questions, and then we're going to wrap this up. Can you, it's difficult, right, when kids are going back to school and spending the day at school and they need a lunch break, right? Because in the pre-COVID days, you all just pile into the cafeteria, right? Well, now that's not safe. So some schools are looking at having the students eat lunch in the classrooms, and they obviously can't wear masks because they're eating. So what are your concerns about that? What needs to happen to make sure that's done safely? That's a tough one.
No, I don't know if it's a tough one, Kiyoki. I just think that going all back into the classroom, taking your mask off is unacceptable. That is not an acceptable alternative. It's another plan that hasn't been thought through. And so if I'm giving you my off-the-cuff advice, I'm having the kids spread out as far as they can in the hallway. I'd prefer all of them go outside somewhere and spread out and maybe be 6, 8, 10 feet apart, thinking of where the winds are blowing, use the trade winds. But first would be an outdoor environment and spread out. Second would be only a small number of kids in the classroom that could be spread out without a mask, depending on the size and the square footage of the circulation. Maybe you're going to get away with 6 in 6 corners or something, 2 4 corners and 2 sides. And then the rest maybe have little markers and little circles throughout the hallways, or corners and cubbies, or gymnasiums, and just have everybody spread out.
Sure. Okay, a couple more here. Teacher wants to know if it is not an in-person day to teach, right, for them to be on the campus in person, or if the school has gone to complete distance learning. As a healthcare expert and a disease expert, would you recommend that teachers have the option to telework, to have fewer folks, out in the community or in the schools on those days when they don't have to have in-person learning?
Yeah, I believe so. I mean, again, I do believe, as I've said at the beginning, my recommendation right now, and maybe we're another hour and a half away that the governor might take some bold action, but we need to go back to the stay at home and work at home. And if you look at where we were back in March and how quickly and effectively that worked, that's going to be our best solution. And we need 2 14-day periods or 1 month, and we will have these viral numbers down, well below 100 and trending down below 50. That's just the way the nature goes, as long as the rest of the state also does use common sense when they're home and spread out, just like we did in March with families. So I hope that answers it.
Sure. We have a question from lawmakers are writing us as well, and they want to know, and I know this is really a question, frankly, for the Department of Education, but do you know, doctor, if nurses at schools, and I know we don't have very many nurses actually in the schools, mostly it's health aides who are not nurses, but do school nurses or school officials have access to test kits to do quick testing?
No, definitely not. They don't have any access to that. I know that for a fact. So No, and actually, Kyoki, that's a really good question, is what kind of standardized education has gone to these health aides or to the school nurses? That should have been where this starts. I mean, you heard the sequence that I just walked through when there was a question about the teacher with the runny nose. That question should have been answered so effectively at a broad scale across the state that there should have been an answer that everybody knew, everybody understands. Because you know the answer that is not effective that I'm hearing and I've seen already in real life being out there? Oh, go to your doctor and get a note. Well, I'm sorry, but I'm trying to not be critical of our medical field and profession out there. But even the education that our medical profession is getting, it is so all over the map. I get some people that just give a note and say, oh, yeah, you have allergies. And they give a note and they don't even do a COVID test on the child. And they just blindly give them a telehealth note where they don't even see them in person because a lot of healthcare now is virtual. And the answer is no, that's not acceptable. That's not acceptable in a pandemic. That's not acceptable where we have the highest spread of the disease. If a child is having symptoms, there has to be a much more thorough evaluation, an individualized evaluation of that child to make sure they do not have the disease. And that should include a test. And ultimately, Kyoki, it will be where we're going to have the at-home tests will be available. I predicted that, and I do believe that's going to be the next step to really help this.
You know, we do appreciate that the governor and the superintendent are working to get more public health nurses in the schools. The governor, right, they set aside some funds this summer to hire 15 nurses, one for each complex area across the state. But we understand they're not going to be, you know, that they're in the hiring process. They're advertising for those jobs right now. And with the state hiring process, of course, that's going to take, I don't even know, 6 weeks to 2 months at least, or whatever, till they're, you know, on the ground so they can help folks within that complex and do that training. When you hear that timetable, what's your reaction?
Inadequate, not addressed of affairs where we're in a state where we're 10 days, 14 days away from having our hospitals overrun, the death rates skyrocketing. This should have been done months and months ago. This is not something you sit here and say, oh, we'll get to it. So if we're going to get to it, well, guess what? Our schools should be shut down until we have a plan. I think everything we're talking about here, the teachers union, the people of Hawaii whose students and families are at risk, there should be an accountability to make these things happen in a safe way.
Finally, Doctor, you know, so many of our members, and of course, people listening, we have thousands of people listening this afternoon, are parents, of course, and they're having to make that decision, right? Come Monday, unless the DOE changes something, you know, they may have to send their kid to school at a public school. What is your advice? What's your recommendation to parents if you had a kid at a public school and you know, they were going to be going in, to reduce not all day, but just for 3 hours to learn about distance learning and maybe do some testing or something? What would you do, and what is your recommendation?
No, no, and no. Basically, grab and go, get your things. Under no circumstances should you consider it safe to put your child into any environment where you have no idea what is going to happen, what room they're going to be in, what the ventilation is, how many other students are there. We don't know what kind of screening the students are having when they're coming in. So the answer is no, not a chance, not even close.
Thank you so much, Dr. Scott Miscovich. Really, you're just doing amazing service to this community throughout the state, educating folks and treating them and giving us accurate information on such a difficult time. We know it's a very difficult time for all of us, and we rely on your scientific medical knowledge to help get us through all of this. So mahalo for your time, and thank you so much, Corey Rosenlee, and thank you to all of you who've joined us from across the state. Again, this entire news conference is available, will be available forever online at both HSTA's Facebook page and at our YouTube channel. And we thank you for joining us. Please be safe out there. Aloha.
Thank you, everyone.
Thank you. Thank you, Corey, and thank you, Kyoki.
Thank you, Dr. Miscovich, and I thank Eric Seitz for joining us today. And for all those teachers, please If our schools are opened on Monday to face-to-face learning of students, please wear black. And we will stay in touch with you about the actions that we need to get the Board of Education to make these decisions as well. So thank you and take care of all of you teachers out there. Please keep safe.